We will now be demonstrating the muscle energy treatment technique for a posteriorly rotated innominate, specifically a left-sided posteriorly rotated innominate on our patient Walt here. If you recall, if the innominate is posteriorly rotated, with our muscle energy treatment technique, we want to rotate it back anteriorly to restore its normal physiological function. In order to perform this technique, we're first going to want to position our patient properly, and what we will have our patient do is, can you please, Walt, just move to the edge of the table. The patient can grasp the opposite side of the table so that they feel more secure and they will not be falling off of the table during this treatment. We can resume the treatment by taking Walt's left extremity and hanging it off of the table. And what we can then do is introduce the patient's leg in between our knees to better stabilize the patient and allow the patient to feel more secure. With our left hand, we'll be contacting the right ASIS of Walt to stabilize the pelvis during this treatment. And with my right hand, I will be contacting the distal aspect of the femur of Walt's left lower extremity. I will then extend that left lower extremity till I reach the restrictive barrier of that posteriorly rotated innominate. Once I've reached the restrictive barrier, I can instruct Walt, if you could just try to flex your leg up towards the ceiling for me against my hand. Good. 2, 3, 4, 5, and relax. We'll take a nice deep breath. We'll wait for that relaxation phase to occur, and then we will further engage towards that restrictive barrier with extension of Walt's left lower extremity. Again, Walt, if you could, please just flex your leg up towards the ceiling. And again, muscle energy is a direct and active technique. 5, and relax. After that deep breath, that relaxation phase, we will further engage that restrictive barrier by extending Walt's left lower extremity. And again, Walt, if you could, flex that leg up towards the ceiling. Excellent. 2, 3, 4, 5, and relax. We'll now go into a final stretch after the 1 to 2 second relaxation phase, further engaging that restrictive barrier of the posteriorly rotated innominate. After the final stretch, we will gently bring Walt's left lower extremity back onto the table. The patient can move back towards the middle of the table and get comfortable. And again, we will always retest in the same initial fashion in which we found the somatic dysfunction. That being rechecking the ASIS levels, PSIS levels, as well as the standing flexion test. This concludes the muscle energy treatment for a posteriorly rotated innominate.